One of the most common causes of myofunctional disorders is actually tongue ties. It's one of it's a controversial area in dentistry, I believe, for two reasons. One is I believe there's a large misunderstanding over what a functional tongue tie is versus just a tongue tie. And secondly, not everyone's aware of the complications that occur whenever there is a tongue tie. So myofunctional therapy, as we're examining a patient, we're looking for limitations of the tongue to make sure that the patients can accomplish the big three efforts of nasal breathing, tongue in the right position, and lips together. But tongue ties are a large detriment to many of even our adults that we treat in our general dentistry practice, because we have a lot of patients here for TMJ therapy and cranial mandibular pain. Along with that, many of them are sleep patients that are trying to actually find a better way to sleep, or they can't tolerate a CPAP. And for most of those patients, a tongue tie is very commonly seen, and that has affected their pattern of function their whole life, and that's led to many of the TMJ pain they're experiencing, to the sleep apnea issues of we can't get the tongue literally into the mouth because of the tongue tie holding it back towards the throat. So it is a highly involved muscle that affects many things in our mouth as well as in our body and our function. So tongue tie is another large part of element 8, and our goal is to try to make sure that it's not holding us up from accomplishing those big three things.